This medication is used to treat vaginal yeast infections. It reduces vaginal burning, itching, and discharge that may occur with this condition. It works by stopping the growth of yeast that causes the infection. The vaginal product comes in two forms, a vaginal cream or tablet. Some products also come with a skin cream to be applied to the area around the outside of the vagina. If this is your first vaginal infection, ask your doctor before using this medication for self-treatment. This medication only works for vaginal fungal infections. If you have fever, chills, flu-like symptoms, stomach/abdominal pain, or a bad-smelling vaginal discharge, do not use this medication. Contact your doctor right away because these may be signs of a more serious infection. If you are using the over-the-counter product to self-treat, make sure to read all directions on the product package before using this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This product is for vaginal use only. Remember to wash your hands before and after use, and avoid getting the product in your eyes. If it does get into your eyes, wash them immediately with plenty of water and contact your doctor if eye irritation lasts. The dosage of Monistat 3 kit is based on your medical condition and response to treatment. Use the medication usually once daily at bedtime for 1 to 7 nights depending on the product used, or as directed by your doctor. If you are using the single-dose tablet, it may be used during the daytime or at bedtime. If using the vaginal cream, follow the package instructions on how to fill/use the applicator with the cream. Lie on your back with your knees toward your chest, and insert one applicator filled with cream into the vagina as far as it will comfortably go. Slowly press the plunger of the applicator in to apply the cream. Make sure to insert the correct cream for use inside the vagina, not the skin cream for use on the outer genital area, vulva. If using the vaginal tablet, you may use either the applicator or your finger to insert the tablet. Unwrap the tablet before use, and follow the package instructions on how to fill the applicator with the vaginal tablet. Lie on your back with your knees toward your chest, and insert the tablet or the applicator into the vagina as far as it will comfortably go. Slowly press the plunger of the applicator to release the tablet. If you have itching/burning around the outside of the vagina, vulva, apply the skin cream to that area usually twice a day for no more than 7 days. If you are using a product with only the vaginal cream, you may apply a small amount of the vaginal cream to the area. Remember to continue using this medication every day for the full time prescribed, even if symptoms disappear after a few days or if your menstrual period starts. Stopping the medication too soon may allow the yeast infection to return. Do not use tampons, douches, spermicides or other vaginal products while using this medication. Unscented sanitary napkins may be used for your menstrual period or to protect your clothing from leakage of the medication. If your condition does not improve after 3 days or lasts more than 7 days, or if your infection returns within 2 months, make sure to tell your doctor. You may need a different or additional medication to treat your condition. If you experience headache, vaginal or urethral burning, itching, pain, or lower abdominal cramps while using the Monistat 3 kit, it's important to notify your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. While serious allergic reactions to this medication are rare, seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so consult your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using the Monistat 3 kit, make sure to inform your doctor or pharmacist if you have any allergies to this medication or other similar antifungal agents. Also, if you have diabetes, immune system problems, or experience frequent vaginal yeast infections, consult your doctor or pharmacist before using this medication. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to ask your doctor about having sexual intercourse while using this product, as it may weaken rubber products and lead to failure, resulting in pregnancy. Do not use rubber products like latex condoms, diaphragms, or cervical caps during treatment with this medication and for 3 days after treatment is over. It's best to consult your doctor about other forms of barrier protection or birth control during this time. If you are pregnant, do not use this medication for self-treatment. It should only be used during pregnancy when clearly needed. If you are pregnant, follow your doctor's instructions on how to use the applicator to insert this medication and discuss the risks and benefits with your doctor. Before breastfeeding, consult your doctor as it is unknown if this drug passes into breast milk. It's important to be aware that Monistat 3 kit may interact with other medications you are taking, which could potentially impact how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with Monistat 3 kit is warfarin. Always consult with your healthcare provider before using this product to ensure safety and effectiveness. If you or someone you know has accidentally swallowed the Monistat 3 kit, it can be harmful. If the person is experiencing serious symptoms such as passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. To help prevent vaginal yeast infections, make sure to dry the genital area thoroughly after showering, bathing, or swimming. Also, try to avoid wearing tight jeans, nylon underwear, pantyhose, a wet bathing suit, or damp/sweaty exercise clothes for long periods. It's best to wear cotton underwear and change it daily. If your sexual partner experiences symptoms, it's important for them to contact their doctor right away. If you forget to take a dose, use it as soon as you remember. If it is close to the time of your next dose, skip the missed dose and use the next dose at the regular time. Do not take a double dose to make up for the missed one. Make sure to store the Monistat 3 kit at room temperature and keep it away from children and pets. Do not flush the medication down the toilet or pour it into a drain unless you are told to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.